How long do biopsy results for bladder health typically take? When it comes to understanding how long biopsy results for bladder health take, many people want to know what to expect. Typically, the timeframe for receiving these results ranges from a few days up to 2 weeks. This period is necessary for the pathology laboratory to process the tissue sample, prepare slides, and conduct a thorough microscopic examination to check for any abnormal or cancerous cells. Let's break down the process a bit more. A bladder biopsy is often performed during a procedure called cystoscopy. In this procedure, a thin camera is inserted through the urethra into the bladder. This allows the doctor to visually inspect the bladder lining and take tissue samples from any suspicious areas. Once the biopsy sample is collected, it is sent to a pathology lab. There, the tissue is fixed and embedded in paraffin. It is then sliced into thin sections, stained, and examined under a microscope by a pathologist. Most pathology labs aim to provide results within 3 to 7 business days. However, depending on the complexity of the case or if additional special tests are required, it may take up to 10 to 14 days. Several factors can affect the timing of the results. If the initial biopsy results are inconclusive, or if further tests such as immunohistochemistry or molecular markers are needed, this can extend the waiting period. After the pathologist finalizes the report, the results are sent to the urologist or treating physician, who will then discuss the findings and next steps with the patient. Timely biopsy results are crucial from a bladder health perspective. Early diagnosis significantly improves treatment outcomes. If bladder cancer is detected early, treatment can be less invasive and more effective, potentially preserving bladder function and improving quality of life. Patients undergoing a bladder biopsy should keep in close contact with their healthcare provider and report any new or worsening symptoms promptly. While waiting for results, it is essential to avoid jumping to conclusions and instead relying on professional medical guidance for interpretation and management. In summary, biopsy results for bladder health typically take about 1 to 2 weeks. This timeframe balances the need for a thorough evaluation with the urgency of diagnosis in bladder cancer care.